Donald Trump apparently is planning on giving everybody a little bit of Medicare for All action. Not exactly Medicare for All, but I'll let his people talk about it. Go ahead, play the clip.
More. Yeah, I'll play it again.
Okay, great.
There's more.
I'm going to provide a brief update on the administration's plans to cover the testing and treatment for the uninsured. Getting the uninsured access to the care they need is a top priority for President Trump. We are already rolling out the $1 billion in funding from the Families First Coronavirus Response Act to cover providers' expenses for testing and diagnosing the uninsured. The CARES Act, signed by the president, includes another $100 billion for
the CARES Act, this is called, already signed by the president. Okay, this is already signed, apparently.
$100 billion for healthcare providers. Under the president's direction, we will use a portion of that funding to cover providers' costs of delivering COVID-19 care for the uninsured, sending the money to providers through the same mechanism used for testing. As a condition of receiving funds under this program, providers will be forbidden from balance billing the uninsured for the cost of their care. Providers will be reimbursed at Medicare rates.
Now, that's the CARES Act that he already signed.
Oh, man. Ladies and gentlemen, not gonna lie to you. This puts us in a dilly of a pickle. A dilly of a pickle. The reason why, and by the way, did y'all listen to that description? So what we're gonna do, we're gonna make testing, in other words, preventative care for COVID-19 free. Then, if you need any treatment, that, all right, wait for it, will also be free. And we're going to pay for it. All hospitals, clinics, physicians, doctors, etc., etc., etc. We're going to pay for it using the same mechanisms as Medicare, and we're going to charge them Medicare prices. And if you don't have health care insurance, well, ladies and gentlemen, you're in luck, because this is specifically for you. If you've been fired from your job and you don't got that great coverage, this is specifically for you. And so if everybody loses their insurance and everybody will be covered through a program that will pay for all people under it by paying through the same system that Medicare uses at Medicare. Y'all, am I crazy? Isn't that basically Medicare for all? Basically Medicare for all. I'm not an expert at this stuff. Know a little bit about a lot, but I ain't an expert in this stuff. But it sounds like it might be the closest thing to Medicare for all that we have seen literally in like ever. Somebody want to answer this question for me? Why the how do the Democrats keep getting outflanked from the left by Donald Trump? Now, don't get me wrong. There are some Democrats who in the legislature who have been advocating for this from the very beginning. Tulsi, Bernie, AOC, Elon, a few have been advocating for this from the very beginning. But there was not really any legislative pressure put on Trump's administration by the Democrats. In other words, in a situation like this one, I'm sure that there's now a coronavirus like committee specifically dedicated, like there's a task force, I'm sure. It's usually how these things work. To encourage the president to expedite the process of making funds available and, of course, making sure that people could get access to testing and could get access to treatment, you introduce a resolution urging him to do it, or a bill forcing him to do it, essentially, as long as he doesn't veto it. And then he would do it under the pressure of Congress. Like, if you wanted to put pressure on him, that's how it would look. But that's not what happened. That's not what happened. I told you all, I covered this yesterday, the day before yesterday. I covered a video where I said, where Trump said, it's not fair that so many people are uninsured. It's not fair. He said it doesn't seem fair that if you have money in this particular situation to afford health insurance, then you have an inherent advantage. And then we find out he actually signed. This isn't conjecture. He actually signed an executive order allocating $100 billion, in which a large amount is to guarantee care for any type of coronavirus treatment and testing. Bro. Look, he's a politician, right? So the executive order is probably not going to do as much as it should. Just insurance companies would not allow that to happen. They just wouldn't. But this is a step in the right direction. In my humble opinion, although there are some circumstances surrounding the coronavirus crisis that would make it a little bit difficult to surmise how effective it is and how possible and plausible all this stuff is. We do have a doctor shortage. Like, that's been a thing prior to any of this going on. So, but as far as the payment mechanism is concerned, right? As far as the accounting side is concerned, this will be a good opportunity because now it's almost a guarantee. You're going to see a huge spike in the use of Medicare because people are concerned about taking care of themselves amid this crisis. And so we're actually going to be able to see live and in action a system that is at least partially implementing Medicare for All. And if it goes well, and this isn't even the best version of it, like as far as, but now it's charging Medicare rates for some treatments. Or no, excuse me. No, I lied. My apologies. This is actually it's almost exactly like the legislation that's been introduced. So at the point of service, the coronavirus treatment and testing will be free. And then the facilitator of that treatment, hospital, physician, clinic, etc., they will be paid Medicare prices. So it's not even like the person is going to be charged. So we're going to be able to see how viable a Medicare for All system is if that system can handle a spike during a pandemic like this one. If it is easier for accounting, if it is plausible, can the staff currently available handle it? And we might be seeing an opportunity to build out from that. If it works, you can almost guarantee that Trump might do this across the board because it will make him look good. Anything that makes Trump look great, and then if it gets caught by the attention of the public, he will double down on it. That's what he does. The moral of the story is, I'm kind of in this, I don't know how to say this, but I'm kind of tired of this narrative that Trump has done the worst job dealing with the coronavirus. Because he hasn't. Has he done a stellar job? Like an amazing? No, not at all. It's not. Has he done the worst job out of any president, any leader? No, that's not true either. First of all, as a president, there's only so much he can do anyway. But he suggested to the HUD, it's not as far as I'm sure he would have liked to take it, based off of his words anyway. He suggested to the HUD to stop evictions and stop any type of defaults on mortgage. Can't kick anybody out the house, can't take any court action or any of that stuff. Trump suggested that before it was done. I'm just being honest. He listened to, Democrats like Tulsi and AOC, who both made these suggestions. Trump liked the idea of a universal basic income. His plan was to take it further and guarantee it monthly. Because he's thinking about economy. But for us, it's extremely helpful as well. Is he wrong about how he's disseminating information specifically to how to deal with the virus? Sometimes, probably. But does that mean that he is handling the virus, at least as much as he can in his capacity? Does that mean he's handling it the wrong way holistically? No, not necessarily. Where he's done good, he's done good. Where he's done bad, he's done bad. But you know what this really means for everybody? It means the Democrats are about to get their asses handed to them come November. That's what the fuck this means. That's what this means. Do you know what this show? Listen, Trump signed an executive order to cover very specific types of treatment for free that'll be paid for through Medicare. He just showed, for future references, remember this, he just showed that a president can damn near single-handedly force Medicare for all on society. Do you know that, right? He utilized his authority in this particular situation in the best possible way you could. He said, I have authoritative powers, executive powers in situations like this. So what I'm going to do is literally give $100 billion to this cause and allocate at least some of that money specifically to making healthcare free at the point of access. And he did it with the stroke of a pen. Think about it. If you like that segment of Mikasa Sukasa, don't forget to like the video and smash that subscribe button. Want access to members only live streams, behind the scenes footage, and other premium content? Well, you can endorse us on Rockfin Premium, become a patron through Patreon, or you can sign up for the MCSC Premium membership through YouTube. All the links are in the description below. But hey, more than anything else, always remember,
Find your balance.
Find your balance.
Find your balance.
Find your balance. Find your balance.
Find your balance. Find your balance.
Always remember, more than anything else, find your balance.
peace.